All right, all right. Let me just do a couple of mini mistakes here real quick. See that. And mute one of these mics. And I believe that just did the trick. Good morning, everyone. Welcome to the Urban Heat R&B Talk on a Tuesday. My name is Steve Gooseby. Got Rich Sports in the building and the one and only Dr. Cyril Ubiem, PhD from Harvard Street Neighborhood Medical. We're going to talk about HIV. We're going to talk about, if I can get the words out, and maybe even talk about a few other things. But how are you today, sir?
I'm doing well. I'm doing very, very well. It's a nice morning.
Good. Well, yeah. It's a little gray out there, but any day is a good day, if you ask me.
Yeah.
A lot of things going on when it comes to health, and HIV is a huge issue. And in some states, I'm hearing cases are up drastically. I don't know how it is here in Massachusetts, but I'm sure you can help us in understanding that. Yeah. So.
Yes. I mean, the good thing is that hello everybody. Good to see you. I'm from Harvard Neighborhood Health Center, trying to bring you guys information about HIV. So the good thing, is that unlike so many years ago, remember during the pandemic, right, when everything was all about COVID, people stopped testing, people stopped thinking about other diseases, including HIV. So the rate actually went up. It went up, because there was no testing that was being done.
Right.
There was no treatment that was being done. Everybody was, of course, locked up in the house. And what do people do? Just have sex.
Have sex, yeah. Everyone's isolated. Exactly. So
kind of like the snowstorms.
Yeah. And then probably maybe without protection, didn't care so much. So what happened at that point? Testing kind of slowed down, or almost didn't exist at that point in time, very minimum, right? Treatment also kind of slowed down a little bit. So there was a spike, basically. So, but now we're post pandemic. Agencies like Harvard Street Neighborhood Health Center, in partnership with the Boston Public Commission, now have programs, like the Ryan and White program that we have. Also have further funding to help us go out into the community and then do a lot of testing, contact distribution, and then treatment as well too. So we are like out there every day, in different neighborhoods. You will see our van, the Harvard Street van with the nice red and white,
So, doctor, I have a question for you.
Yeah.
So you say HIV is on the rise. Is that nationwide or is that Boston, Massachusetts. What are the numbers?
Is it up alarming or is it a little bit? How much?
Yeah, I
What
mean,
are we talking about?
it was an alarming stage, right? But that was like a couple of years ago, though. That was like 2022, 23, 24. But now it wasn't. It was rising then because there was no treatment going on. There was no everything kind of slowed down, right?
There was basically no testing because the
Ex-
hospitals was backed up.
Everything
from
was shut
COVID.
down. Yeah,
Exactly. That
Yeah.
makes sense. Yes.
yeah. So remember how it was that time during the COVID period, right?
No,
Yeah.
you're right. Because I remember it took me about 7, 8 months to get my regular checkup with my primary care doctor. Yeah, it took me at least 6, 7 months to get in there. They were trying to push it for almost a year, but I had to really push the issue for a regular checkup.
Exactly. So what happened was that now there was a little spike at that point in time because now nothing was happening. Like the kind of services we provide right now. I mean, there was no prevention services going on at that point in time. So people were just definitely left on their own. So what happened is that and I can tell you, right. So between 2021 and end of 2025, we had about 36 HIV positive individuals in our treatment. So these are people that probably wouldn't have been identified within that period of time. And what happens with people not identified? People don't know the status.
They don't. They just go around and they continue spreading it to other people.
Exactly.
So, doctor, I have a question for
Yeah.
you.
Yeah.
Rolling back the clock to the early 1980s,
Mhm.
when AIDS became kind of a well-known thing in our society.
Yeah.
Do you believe right now with HIV, because there's been reports out there that some people feel like you might die quicker from having diabetes and HIV because of the treatment, the medicine that's out there now, the cocktails and everything. Do you feel like people have let their guards down to HIV and just look at it differently than they first did in the 1980s?
I won't say that people have, let their guards down. People have always, because of the stigma associated with HIV, people always treat it differently. There's a lot of stigma associated with HIV. So people, back in the day, when someone, you catch HIV, they classify you as either, being promiscuous or just being, you're about to die, basically, right?
Yes,
Or being
exactly.
infectious, yeah. So, and then people were scared of knowing their status to avoid the stigma,
Yes.
So I think there's still a little bit of that stigma still going on even right now to this day,
Yes.
honestly speaking.
Yes.
And yes, the treatment has really, really improved so much. Remember back in the day, the treatment was to the extent that it was a bit toxic to people, even though it wasn't as effective as it is now.
Yeah, it was a death sentence.
It was a death
Pretty much.
sentence.
Yes, I know.
And then the
people-
medications were not working very, very
Yeah, I
well.
know people that in the early 80s contracted HIV or AIDS and they died very quickly.
Yeah, exactly.
And I heard from people in the medical field back then, the cocktails were very toxic to the human body. And over time, the treatment's gotten better. I mean, when you look at someone, okay, let's just say Magic Johnson, it's been 35 years, maybe 36 years
Mhm.
since he first came out with HIV. Now, what do you contribute his longevity of having a good health and living this long? What do you contribute that to?
Besides money.
Yeah.
Yeah.
So his longevity actually is as a result of medication, good
Okay.
medication that he was taking. So, which is now the medication that he's taking now, which has now been refined to this day now is actually, making people live long and live healthy. So there's what CDC calls. So back in the day, it used to be cocktails, so like
Yes.
multiple medications, maybe multiple times a day. Now you only have one tablet a day that you take, and then someone is, there's no cure, right? So what happens when someone contracts HIV? It's like any virus, right? When you get it, and then the amount of virus in the system starts getting higher and higher. right? And then your immune system starts going lower and lower. You know, the same thing with HIV. So someone contracts HIV, the HIV virus in the system starts going up and like in millions, multiplies in millions and millions and millions. And then the immune system, start going lower and lower and lower. So when people, so that's why, they say that HIV doesn't really kill someone, is the other infections that people get actually kill people. So when someone starts taking, the medications, the good medication that we have right now, so what it does is that it starts killing all those, those viruses. It starts getting the virus to the point that the virus is now so low in the system, is now undetectable.
Yes, I was going to ask you. That was going to be my next question, and you actually answered it. Well, I've seen reports that with the new drugs, the HIV in your body becomes undetectable. But can you still pass it on to someone?
So when they say the HIV is undetectable, right? And then someone is undetectable, they cannot pass the virus to someone else. All right. So, and that's exactly what we're trying to get to the point where virus is undetectable, so they cannot pass the virus to somebody else. The CDC calls it U equals to U. All right.
So you can basically say you're on the cusp of having a cure for HIV.
It's not a cure for it. It's not. There's a cure for for Hep C, for example.
Yeah.
But there's no cure for HIV at this moment.
Okay. And so what?
I'm going to break.
You want to take a break?
Yeah.
Okay, sure. All right. We'll take a little break with Dr. Cyril Ubiem, but we'll be right back. Rich and you and I, we're going to hang tight.
Okay.
All right. So you're good.
Okay.
Yeah, you're go ahead. Take care of that. So he has to take a call, very important call. So so one of the questions that when he comes back, I want to ask, like, what are the symptoms? Like, how do you identify, what does AIDS look like? You know what I mean? For a person that has it.
Well, Steve, that's a good question. I mean, in the early days, people will get, they say, flu-like symptoms and stuff like that.
Yeah.
And they would just feel sick and weak and get flu-like symptoms. And then people will go to the hospital and then they will get tested. And from my understanding, I'm not a doctor, but being HIV and then AIDS is a full-blown sickness of it because the immune system breaks down.
Right.
But I always feel like over the last few years, people don't take HIV that serious because of all the drugs they got out now. And because of the lifespan, when you look at a guy like Magic Johnson and whoever else is out there.
Right. It's no longer a death sentence.
It's no longer a death sentence. I mean, you get diabetes. I mean, if you eat right and change your lifestyle, diabetes is reversible. I've known people that have reversed diabetes by changing their lifestyle and eating right. So I think now people look at HIV as the same way. Hey, if I get it, I take the cocktail. So like you said, there's a lot of people walking around HIV positive. They don't even know it. Right. Wow, that's amazing when you think about it.
Right. I do have some other questions. I don't know if he'll be able to answer them.
I'll try.
In terms of, all right, so he's back. Let's get him back up here. So
should I be looking at this camera or this camera?
The camera,
the laptop, right?
Yeah, on the computer. Okay. You actually don't have to look at it. We can,
Yeah, okay, but I just want to make sure I make eye contact sometimes.
Yeah. So Rich and I was just talking, like, what are the symptoms for AIDS? What does that look like? How do you identify a person, or can you identify a person?
You can't really know when somebody has HIV. So there's a difference between HIV and AIDS, right? So the AIDS status is when somebody's immune system is so low, like in the medical term, say your CD4 count is below 200, right? So that person is now achieved the AIDS status. The AIDS status is like when someone gets to an AIDS status, the chances of actually dying is very high. So that means the virus is they're not in treatment, they're not receiving treatment. The virus in the system is so high, and then the immune system is so low, and then any infection can actually kill them. So that's what to a lot of people that die from HIV infection.
They actually die from
They,
some
they
type
actually
of,
die from
like getting a cold or something, and then they can
Yes.
turn into pneumonia or whatever.
Exactly. So they're now
Yeah.
into like they're now into the AIDS status right now.
I see.
So pneumonia, anything, we just kill them at that point in
Okay, I
time.
got you.
Yeah.
Now, what's the age group? What do you, when you see that, when you get these positive cases, what's the age group, the highest amount of age group right now?
There's a lot of young people that actually it's everybody. There's all wide range, right?
Yeah,
But there's we're seeing a lot of younger people right now.
yeah,
that are contracting HIV. Honestly speaking, we're talking about like people as young as 18.
Wow.
To 24 to middle age as well too. So it's people are still having unprotected sex. People
Yes.
still don't. And then I think the issue is that people don't know their status, so they're now maybe intentionally or unintentionally passing on somebody else.
Yeah,
There's a lot of people that have multiple partners.
yeah,
So we now say, listen, there's what we call PrEP, pre-exposure prophylaxis. It's like a preventive medication that someone can take, one tablet a day as well too, right?
Mm-hmm.
And it can prevent you from catching the HIV.
yeah. I've seen them advertise that on television. Yes,
Yeah.
yes.
It's real. It's real.
Uh-oh.
And then we do have a lot of programs now. Unfortunately, if people catch HIV, there's a lot of services out there.